we minimize things so bad in dentistry. It's like, oh, you've got this little small cavity. No, you have a hole in your tooth that needs to be fixed.
This is Growth in Dentistry, a dental intelligence podcast where we ask the question, what does growth in dentistry look like to you? I'm Katie Polson, a dental hygienist and your host. All right, welcome. I want to introduce Curtis Marshall to you as VP of our partner relations here at Dental Intel. So
Thank
glad
you,
to have him
Katie.
hosting with me today, and he's going to introduce our very special guest.
Yeah, this is the guy. Now, if you like crawdads, if you like good people, if you like fishing, if you like a good time, Gregg May is definitely that man. In addition to all these amazing things, Gregg May is also a fantastic clinician. If you haven't heard of him yet, he lives in Louisiana, and he's been able to really start from ground zero a couple times and take it, and you'll see why. It's not because of him. He's been able to take it to a world-class, super world-class practice. So much so that we're going to take a lot of good things from him on how to take better care of our patients, but more importantly, how to grow in dentistry.
Yeah. Awesome. Yeah, I'm so excited to talk to you. Your tenacity
Awesome.
of rebuilding your practice multiple times taught me a lot about your ability to connect with people. And one of the things
Sure.
that I heard you say before was you do things for the right reason for the patient, and the money will follow. And I'm excited
Right.
to have you talk about that today. So we're
Awesome. Yeah,
talking about
that's well, go ahead. Now,
no.
I'm just gonna say that's one of my core values, that I've learned through the years. Do the right things at the right time with the right people, and everything else falls in
Yeah,
place.
exactly. That really is at the core of dentistry. We get caught up in all of the craziness, like all of the consulting and doing this and this, but really it's about treating people. And if we treat them right,
Absolutely.
people will come. Yeah, for sure. So we're talking about feeling chairs today. And the best
Okay.
way to do that is to diagnose and to actually get treatment in the books to do that. So with that being said, give us a brief. I've heard you talk about the 80-20 rule before, 80%, 20, and I want you to talk a little bit about that and case acceptance. Give us what you can
Sure.
about what you know about case
Yeah,
acceptance and
yeah, I'd
getting
love it.
people in the chair.
Sure, we can talk about all that stuff, Katie.
Yeah.
And enjoy doing it. And Curtis has heard my lectures and some of this stuff as
Mhm.
well before. So, talking about diagnosing, obviously I'm still a dentist. I practice, every week in my office, but I don't practice full time because I'm also a coach and consultant and speaker as well. And I get to go into a bunch of practices all around the country. And generally, when I go into these practices and do a case presentation workshop with them or a case acceptance workshop, the first day I'm kind of a fly on the wall. So I get to see a lot of stuff.
Mhm.
I get to watch a lot of dentists, hygienists, and team members, all day long try to do their due. And and generally a lot of times, before I go in, I do look at their case acceptance percentages, and there's a few different ways and a few different algorithms. And Curtis and I have talked about that,
They're
of how to
fantastic.
figure out what your case acceptance is, and I mean, dental intels are awesome, but I mean, the basics for me for case acceptance is, every person that I see needs 2 appointments after they finish, that current appointment. They need a restorative appointment
Yeah.
and they need their hygiene recare appointment. And if
Every
they don't,
time. And
every
Dr. May,
single patient. Yeah.
this is something that you've really said that that I don't hear very often,
Mhm.
because what we see typically is that
Uh-huh.
a patient gets treated or diagnosed treatment, right? And one of two things happen. They either say no to the treatment and we reschedule them for hygiene, one,
Hmm. Yep.
or they say yes to treatment and we're so excited. Remember Tommy Boy when he's eating and he's like,
Yeah.
I feel like it's my little pet,
I know. Yeah.
right?
They get so
Just
excited.
like
Yep.
that, we do that same thing when people accept treatment and we forget to sign them up for for
For
hygiene,
recare. Yep.
Right.
right?
For hygiene
And
recare.
so I
Yes.
Yep.
love how you bring that in, and that, Katie, is
Mm.
what for this whole this fantastic series that we're on right
Mm.
now. That's one way to realize how to fill chairs,
Yeah, for
right?
sure.
So great. Sorry to interrupt you, but I
Two.
love
No.
whenever you talk
No.
about that.
No, 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 that's wonderful, man. And that's just the way that I've learned throughout my practices that I've I've gone through, rebuilding all those times and stuff like that. But I had a bunch of coaches and mentors in my life that helped me to get where I'm at as well, through there. And so I'm at the point in my career where I'm giving back, and I want to teach a lot of dentists, how to get their case acceptance, percentages higher. I don't like. I mean, Curtis, I think last time you and I were talking about it, I think the national average for case acceptance is what, 42% or something like
That
that.
sounds about
Um,
right.
it-
Hmm.
that's really low. I mean, in my practice, if I'm not running at 80 to 90% case acceptance, we're sitting down and we're having meetings about it. But there's a background about us dentists and a little bit of the why we do some of those things. You know what I mean? I mean,
Mm-hmm.
you just brought up, a really good point. We either get too excited or they say no. And when they say no, we don't really know how to counter objections or anything like that.
Hmm.
Because we're not really taught that. I asked my mentor years ago, Dr. Omer Reed, if he could go back and do something for our dentistry to really change it for the better, what would he do? How would he have changed what he lectured on throughout his career? And he leaned over and simply said, son, behavioral sciences. We don't know it. We don't use it. We don't learn it. We want to learn all about the newest, greatest technology and toy and laser and crown preps and, veneer cases and occlusion and the latest imperio scaling and, all this stuff. But we don't spend any time on behavioral sciences. And he told me that years ago. I mean, right after Hurricane Katrina hit me and I lost my office in Katrina. And I was able to take that knowledge and really work with him and really understand about building relationships with people and what that was all about, as far as that goes. But I mean, the offices that I go in, a weakness is diagnosing. We've talked about that before, Katie.
Yeah.
When
Yep.
we but
Hmm.
I have to go a step further, and I've learned throughout my career, and of course, Omer again is responsible for this. We don't question even our own systems sometimes in the way that we do things. We don't ask
Yeah.
why. You know what I mean? We don't ask ourselves why. We just do it because we saw it done that way before, or that's
Hmm.
how we learned in dental school, or that's how we learned case presentation at whatever institute you went to, or whatever. And you start to develop your own style. You know what I mean? But what I do know about dentistry, as a whole is dentists, we're in a crazy job. I mean, number one, patients sit in our chair and we have to deliver bad news all day, dude. I
All
mean,
day.
Yeah.
what an
And
exciting, like,
and it starts with them sitting in the chair saying, "I hate dentists."
I know,
That's what it
Right.
begins
exactly.
with.
Yeah.
And usually my
Mhm.
comeback is, well, I'm the dentist. You don't hate dentists because I'm awesome,
Yeah.
but you probably hate dental procedures.
As a hygienist, my comeback is, "Well, great, I'm not one."
Yeah, I know you got it easy, girl. You got it
Yeah.
easy. But anyway, but because of that, years ago they did a Kellogg study, like I think it was in the 70s or the 80s, about, they tracked a whole lot of dentists, and they tracked the number of diagnosed dentistry as the week went on. And what they found was, on Monday when you're fresh and everything's good, your
I've seen this
diagnosed
study.
dentistry was up
Mhm.
there. And then as time goes on, by the time you hit Thursday afternoon, man, you're like rolling over stuff, and missing it purposely because you're tired. It's been a long week or
You're
whatever.
ready for
But
the weekend.
you
Yeah.
ready for the weekend? Because
Greg.
what have you've been doing tough procedures all week, right? But so what do we do as dentists? We minimize things so bad in dentistry. It's like, oh, you've got this little small cavity. No, you have a hole in your tooth that needs to be fixed.
Yeah, exactly.
And Greg, we saw this exact same. So as we track numbers, especially during COVID, right?
Sure.
We saw that exact same thing happen in June and July and some in August, that record breaking diagnostic and acceptance percentages
Hmm.
Yeah.
based off of what you just said there, right?
Right.
Hey,
Uh-huh.
I've been not working for a
For 3
month. I'm
months.
excited to come back. I'm excited to tell you, patient, that you need this. And I'm going to do a thorough exam because
Yeah.
that's where it starts.
Yes.
If you
Right.
want to get a good or fill those chairs, even before selling it. And I
Mm.
love to I love the way Gregg, if you haven't heard him speak yet, gotta talk. The selling, there's a bunch of different types of salespeople, but we do sell dentistry.
We do.
Before that happens, you have to find the issue and really see it. Because if you don't present it, in fact, my brother-in-law, he's a dentist. Love him to
Mhm.
death. I'm not going to tell you which one
Yeah.
because of this next story. My brother-in-law said, there are times when I've got two people numb in the back, right? I just got out of one exam. I'm doing another exam. I know this patient's a good patient. They come in every 6 months, right? He
Uh-huh.
knows them. And he sees that there's like a little soft, I don't know how to diagnose, but he says,
No, I
I
know.
see that there's something. And I go, hey, hygienist, will you put a watch on that?
Yeah.
Right?
Yeah.
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 And he knows what it is, but he doesn't have the time.
To talk about it.
Maybe he's tired. Maybe he's busy. Maybe he's stressed out at home. Maybe his cat died. I don't know, but you've got to diagnose it first.
Yeah.
And that's
Right.
where you're brilliant.
Right. And diagnostics and obviously her as a hygienist, you know, I mean, my hygienist, you know, pre-diagnose a lot of things for me as
Yeah,
well. And they
that's what I
have
was
those
thinking.
conversations as well. But, you know, and to me, a patient needs to hear it from three different people that that
Who?
something's there so they can
Who?
own it.
The
From
three.
the hygienist,
Yep. Number
from
one.
the dentist,
Yep.
and from a
treatment
financial
coordinator.
coordinator.
Yeah.
Yep.
Yep.
They need
Okay,
to hear it
now.
from all three of those people
Yeah.
because how many times, you know, does a dentist, you know, walk into a room and diagnose something and walks out and then turns to the hygienist and goes, do
Every
I really
time.
need that? You know what I
Every
mean?
time.
It's like,
Really?
it's like,
Yeah.
yeah, because we
And
already
that,
talked about it.
yeah,
You know?
and I like to tout a lot that the hygienist, and you've talked about this before, and I would love for you to talk about it a little bit more, is
Sure.
that the hygienist should be a resident educator in the office. And when
Absolutely.
I'm seeing patients, all my brother's a dentist, my dad was a dentist, all they have to do
Uh-huh.
is step in, say, and I over, my handoff is this is what we talked about. This is what it looks like. Here's what it's going to be, possibly. What do you think? All he has to say is yes. That's all he has to say,
Right.
right?
Exactly. You've
Yeah.
pre-diagnosed it. You've already talked to the
Mhm.
patient. You have more trust with the patient than we do because you've spent time with them. You know, we're in the middle of, you know, it's like you say, Curtis, you know, I can have two other chairs going with two numb people and, you know, trying to get procedures done. And, you know, I run into an op. I don't have time to sit down a lot of times and build a lot of trust and in a short amount of time like that. But my hygienist has. So, you
Mhm.
know, you have to utilize it from a team approach, you know. I mean, that's the way case acceptance really
Yeah.
goes up is if you do it as a team approach. And a hygienist is in my opinion, sometimes more valuable than the dentist, you know, at
Mhm.
pre-diagnosing things. You know, one of the issues that I see sometimes that happens though is, you know, I don't like to go into any op blind. What I mean by that is I have a little mini huddle in the hallway with my hygienist
Mhm.
or with any team member before I walk into that op. You know, it's like
What does
we
that huddle
need
look
you
like, by the way?
that's a
Because
quick little that
this is leading exactly into being proud of your work in
oh
order to
absolutely.
fill in order to diagnose, in order to fill chairs, right? So
Right.
this is a great little nugget. If you're
Yeah, listening.
listening, or
Yeah.
if you're in a car, make a mental note. If you're at your desk, write it down. What is this? What does this huddle consist of? A
Because
mini huddle in the hallway. Go ahead,
yeah, because
Katie,
this
first.
gets this as a hygienist, it's really easy to skip this part. It's really easy to just wait
Oh
in the
yeah.
room or wait for them, or you're so busy running from room to room. This doesn't get done. But if it
No.
did, and what it does with you, I bet it makes a huge difference.
Yeah,
Yeah.
let's hear.
Oh,
Yeah.
Tell us a secret there.
it's a huge difference. Well, you know, and what taught me to do this huddle was I had a superstar hygienist that was extremely well trained, and I paid for a lot of coursework for her to go to, and you know, and to really get more involved with pre-diagnosing things for
Mhm.
me. And you know, I was in a hurry one day, many years ago, because I've been doing this huddle for a long time now. But you know, she's a superstar hygienist, and she had spent quite a bit of time talking about a tooth that needed a crown with a
Mhm.
patient. And
Mhm.
I didn't have this huddle, and I run into the op, and I'm like, nah, I think it'll be fine with an MOD filling. And
Yes.
I
It
just
hurts
Katie's
me.
undermined
been
my
there. She's reliving what just
I know.
happened.
I just totally undermined my hygienist. And if you have a superstar hygienist and you
Mhm.
undermine them a couple of times, do you really think they're going to continue to talk about pre-diagnosis and
They
treatment
won't.
with your
They
patient?
give up.
They give up. They're going to stop. They don't want to
So
be
what's this
undermined.
huddle? I'm so anxious to hear. What does this
So
huddle look like? I'm sorry,
it's
Greg.
and to me it's really quick. I mean, with some patients you're talking about 30 seconds. For if it's a new patient sitting in my chair, I run up to the patient. I run up to my hygienist, especially when they're new, and I do a little joke, and I always do this. I hold my hand up, you know, and that's five.
Mhm,
That doesn't mean stop. It does
mhm,
mean stop and tell me what's going on, but it also means tell me five personal things about this patient. I want to know five personal things about the patient first,
mm.
because if you want to
I
start to
love that.
develop rapport with a patient and eventually get to trust, and we confuse those two in dentistry. If you learn anything about behavioral sciences, rapport and trust are two very different things. I mean, I
Yes.
Mhm.
can run in and get rapport with a patient and laugh and giggle and ease their anxiety and fear and introduce myself and really listen to them and listen to what's going on with them. But to get to a level of trust where anything that I diagnose they're on board, that's a different level of doing things. But you've got to take things in steps, but you do have to develop that rapport really quick
Mm,
first, right? And for me, I want to know those things, because if I go in and I talk to a patient, then it makes us look more professional. It makes us look like we communicate. And I'll give you a
mm.
typical example of this. And Curtis, you've seen me. I had salmonella food poison, and I've lost like 25 pounds. But I went to
It's
the
a good.
doctor's
It's
Is
not the
that
office.
best diet, but it's
is
a
that is
diet.
that how you do that? I need to
Yeah, yeah, no, you do
did not
not
do
want it that way.
okay.
But anyway, but something really irked me about my visit going to the practice, going to a medical office. And if you on a disc, personality thing, I'm pretty type D. My time is important. And I go in there and I walk in, and the nurse is like, "Why are you here?" And I'm kind of like, "Well, I wrote it on the piece of paper while I'm there, but you
Mhm.
can't read." And then the doctor comes in, and it's like, "Why are you here?" And I'm like, "Did y'all not talk in the
Every
hallway?"
time for me when I go to the
Yeah, it's all
doctor.
the
You see,
time. It's
Every
so
time.
so frustrating.
and it drives
Mhm.
me insane. And so that little huddle gives me a lot more information about their personal things. And also, my hygienists are very, very good at repeating the same thing over and over again. We inform before we perform all the time. They've heard me say this thousands of times. Inform before you perform.
That's
And
great.
we tell the patient, we're going to
Mhm.
look at five things in your mouth. We're going to look at the cosmetics of your mouth. We're going to look at your gum health. We're going to look at each individual tooth. We're going to look at your jaw movements and the function of your jaw and how well you chew. And we're going to do an oral cancer screening on you. I mean, but we tell them every time what we're going to do, before we see the patient. And we even say that on periodic exams. Again, we're going to review all these things. And how do patients walk away? They feel like that was a thorough exam, right? That
Right.
was a
Hmm.
comprehensive
Mhm.
exam. And but I want that feedback. I want to know why the patient's there. I want to know some personal things about them, and I want to know if they're a wreck or not. I mean, because for me, when I do my case presentations and stuff like that, anything over about a $6,000 treatment plan, I generally have the patient come back for another consult visit, because
Mm.
it's a large amount of treatment. A lot of times, if I'm in a busy practice, I know I don't have time, and I don't want to rush through my diagnosis because I'm going to miss something.
Yeah.
And that's probably the biggest thing I see going into practices is the doctor's always in a rush. Well, the patients feel that too. And I mean, just another trick,
It's an
that I learned
energy,
through the
even.
years.
Mhm.
Yeah,
Even right?
it's an energy. And what is communication as well? Communication is 80% nonverbal, guys. You know what I mean? So I
Crazy.
mean, if you
Yeah.
running in and you're in a hurry and you're bouncing
Washing your
around
hands
and
at the sink,
what
not looking at them. Yeah.
right,
Yeah.
right. I mean,
Mhm.
so many little things. When I
Mhm.
sit down with any patient, I sit in my chair and roll back, cross my legs and cross my arms and lay back, because I know they're reading my body language. But what does that tell the patient? I'm here for you to talk and me to listen. You
And
know what I
you're
mean?
and
And
it
I'm
tells them that you're comfortable.
Yep.
I'm getting comfortable so
To
that you can tell
listen.
me. Yeah.
Yep.
right,
Yeah.
exactly. So, there's a
Mhm.
lot of little things that you pick up over the years that you can do, if you really do things and ask why you're doing them. Everything
Mhm.
I do is purposeful. I've always viewed my office as a Broadway show. When the
Yeah.
doors open in the morning, it's time to put the happy face on and everybody gets into the
I
place and
I
do their
love that.
thing,
That rings so true to me because I I've switched over into this role in dental until
Uh-huh.
I still see patients occasionally. But the one thing that
Sure.
dentistry is so emotional. It's
So
so
Absolutely.
mentally exhausting. It's not, it's physically exhausting doing the same thing again and again, especially as a hygienist, but it's so mentally exhausting. And so I love that. It is a show. And at the end of the day, I felt like I was done with the show.
yeah,
Yeah.
Yeah,
exhausted of
Yeah.
absolutely.
smiling,
Yeah.
exhausted of
I know. I
hosting
know.
and
Yeah.
We
whatever,
have
right?
tough
Hmm.
jobs, and
Hmm.
it's so funny because my brother owns an anesthesia firm, and he's
Hmm.
like, "Man, I don't see how you work on woke patients all day." I mean, I'm
Right.
like,
Patient.
"Yes, it is
Yes.
True.
emotionally draining,
It is
all
so,
day long." So we do have a tough job. We have
Yeah.
a tough job, but we do have to think. I mean, brilliant things happen when you diagnose more dentistry. I say this all the time. If you want to do quadrant dentistry, take quadrant intraoral picks. I mean, don't take
Mm.
single tooth picks. If you want to do
hmm
single tooth dentistry, take single picks. We don't take enough diagnostics sometimes in our
yeah.
offices because
hmm
we're behind or my hygienist is behind or whatever. That's unacceptable. We've got to get what we need to make a proper diagnosis and to give our view. And the other part about making a proper diagnosis is also you do need the clinical training. I've heard it 1,000 times. If you only have a hammer, you're only going to see nails, right? So you do need to open that clinical toolbox. You need to learn new stuff and great stuff. And you talk about growth in dentistry. That's one of the places that growth in dentistry I think really amazing. I mean, to me, it's an exciting time to be a dentist because there's been a few things happen over the last 10 years that have really changed and will continue to change dentistry. The best thing and the worst thing that has happened in a long time is COVID. But it allows us dentists and hygienists, instead of us being tooth mechanics and y'all tooth polishers now, we can move back into that role as being part of their healthcare team, right?
Yeah.
And really,
Right.
use our training,
Mm-hmm.
use your training as a hygienist, as a patient educator and talk about things.
Mm-hmm.
And I can go, I go in and I'm having different conversations now about infection and immune systems and things of that nature. So it's changed. But not only that, I mean, look at the services that we provide compared to what we did 10 years ago. I mean, how many people are doing sleep apnea now? And implants were not a big thing, 10
Yeah.
years ago.
Well, it
I
was
mean,
like you're a GP and you're doing implants.
Right.
That can't be. You
Yeah.
can't do that. Like,
Yeah.
right? That's
right.
that's changed quite a bit.
My brother
Yeah.
did an implant on me about 10 years ago, as his sister, and he put me under too. It was a very
Yeah,
interesting, he
that's
did, I'm super, super confident in him, but it wasn't common. Yeah. Yeah.
Right. That's awesome. I love
hmm
it.
and it's going
Family
to
members
even
working on
increase.
family members.
Yeah.
Yeah.
And I
But
was
but I
totally
mean,
out. I don't
yep,
even know what
I
he did to
understand.
me. No, I'm just kidding. Yeah.
Zip lips on that one. But the services that we offer is just way up there. People are coming in asking more questions about their health and their wellness now because of COVID than ever before. And I think that's changing too. But I mean, along these lines, I mean, it lets us do some really cool things. But I mean, when your case acceptance goes up and you're diagnosing more dentistry and you're diagnosing a larger gamut of oral health issues, in your practice because you've got the clinical knowledge and the clinical training, great things go up. It's Curtis, you and I talked about this one time. I mean, every day, I don't like marketing. I actually don't. And I don't like the word sales because, when you hear the word sales, you automatically think of a used car salesman.
Well,
And,
you don't like the
push,
word, but you are,
yeah.
and this is one thing
Oh,
that we've talked about is you are selling, but keep going.
oh, absolutely. And you have to sell yourself before you can sell any kind of dentistry anyway, too.
hmm
Right. But anyway, as far as that goes, though, you don't have to be pushy with treatment either, because if you're pushy, it destroys your reputation over a long period of time. That you shouldn't be pushy, but you should be educating your patients. Now, the other mistake that most dentists make is we have this false belief that we can educate our patients into treatment. Unfortunately, that's not how people buy things, and most of the general public really views us as elective services. You know what I mean? So
Mm-hmm.
patients buy from emotion and they justify it with logic.
Yes,
But
absolutely.
most of us technical engineering type dentists, we want to start talking to them about all their little teeth and not how it
Mhm.
affects their life. You know what I
The
mean?
Hmm.
occlusal and the
Yeah.
distal and the
Yeah,
lingual and
all those big words. Huh? I know, and
Hmm.
not in using more layman's terms. We get into that
Hmm.
so many times. I've heard so many people, talk about, well, you have periodontal disease, and the patient's looking up, going, "What
What
the
is
hell
that?
is that?"
Right?
You have an
Hmm.
infection in your gums,
mm-hmm.
and they're
Yep.
bleeding.
Really
And you
sad.
probably can't feel it.
Yep.
Yeah.
Yep.
Yeah.
Right,
Now
right. But
this
Yeah.
is
there's
really
so
good. This is really good
Such good
stuff, Greg. There's something
information.
that really hit home to me as
Hmm.
you've been talking, and this has really been fantastic. But one thing that really hit home to me was that there's three people that are diagnosing or
Or
presenting
presenting
treatment,
treatment.
right?
It's a team effort.
It's a team
yeah.
effort. But
Hmm.
one thing that's interesting is that you need to be proud of your work,
Hmm.
right?
Oh gosh, yes,
Guess
yeah.
who else needs to be
And
proud
your
of your work?
staff does.
Yeah,
Your
your
staff does, yeah.
hygienist, yourself,
Hmm.
and your treatment coordinator. They all need to be proud of your work.
Yeah.
Hmm.
So that's
Yeah.
something that.
It's really great.
Thank you for sharing that
Yeah.
because that's something that really stuck out to me.
Yeah. So we have a final question that we ask each of our guests, and it
Sure.
is,
You ready?
it's about growth, because growth can be so personal to so many different
Sure.
people. What
Uh-huh.
does growth in dentistry look like to you, especially now that you've grown so many times
Oh yeah.
as a clinician and as a practice? What does it look like to you now after you've gone through all that?
I talked a little bit about it. I think it's an exciting time for dentistry because our services, the number of services that we can provide our patients have just skyrocketed, on how we can help our patients.
Mm-hmm.
And I really think that, us being more part of the healthcare system is a great thing. But to me, some of the things that I'm looking at and, as a consultant and speaker and talking to a large number of dentists constantly, I'm noticing trends and patterns, and a lot of people are understanding that having a group office and a group practice where specialists are coming in or part of the practice, and multi-doctor offices are a good thing. You don't necessarily have to quote unquote compete with corporate dentistry, but I mean, if you
Yeah.
do want to compete with corporate dentistry, I mean, I say this all the time. I usually start my case presentation workshops with this: what separates your practice from every other one? I mean, why do people come here? And so many people can't answer that simple question. It's like, what makes you different than every other dental office around the block? And
Mm-hmm.
sometimes there'll be 40 or 50 dental offices, within a mile of each other, like in Houston, Texas, or somewhere like that, right?
Salt Lake City, Utah.
Or
Yep.
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 or there.
Mm-hmm.
So, to me, having a high level of customer service and a wonderful, patient experience is wonderful. And developing that deep trusting relationships with your patients. You don't need 100 new patients a month to do $1 million a year. I was doing $1 million a year with 20 averaging 20 new patients a month, because I take the time to spend with my patients to diagnose dentistry, to develop that relationship, to do it with a team approach, so that my case acceptance stays high. And when you're doing a high level of case acceptance, you're doing a lot more dentistry at once. You're doing a lot less single tooth dentistry. Now, all that comes in, I get it, but you're doing more at one time, because your case acceptance is going up, right?
Yeah.
And I'm
Yeah.
not
That's
spending a
awesome.
bunch of marketing
That's
dollars.
that's a
I
great.
love how. So what I'm hearing for you, growth in dentistry means to Gregg May is case acceptance, diagnosing the right treatment for the right patient, and then getting a case acceptance. That is growth in dentistry to you.
And making it,
That
Is that accurate?
yeah, and doing more with less, really. I mean,
Yeah.
and don't we all want to just, why
Oh,
would you work twice as hard if you don't have to? You know
yeah,
what I mean? Yeah.
absolutely. And I know
Yeah.
I know we play that insurance game, and
Yeah.
insurance is here to stay, but still,
Hmm.
you don't work for the insurance companies. You
No.
work for
Hmm.
the patient,
the
and you
patient.
should not be diagnosing based on insurance. Oh,
Yeah.
insurance won't pay for this, or won't pay for
Hmm.
that, or won't pay for this. I mean, I go into practices and they don't even have an FMX on every patient in the practice, and I'm like, why not? Well, insurance won't pay for it. And I'm like, and they're like, well, I'm just not going to give that away. I'm like, okay, well, stop giving away toothbrushes and floss to your patients too, by the way. You know what
Right.
I mean?
Yeah.
I
I
mean, if
mean,
you're
if
going to
you're
be
going to
that
give away
Oh,
cheap,
something, that is
brilliant.
brilliant. If
I
you're going
didn't
to give
think of
away,
that.
That is so
Big
good.
takeaway.
Yes. If you're going to give away something, give away x-rays and diagnose instead of give away
Right.
toothbrushes and floss. That is,
Right.
yeah.
Interesting.
Yeah.
Greg,
Absolutely.
Yep.
This has been awesome.
Yes, yes. It's been so great. Well, this has
always a
been Growth
pleasure.
in Dentistry, a dental intelligence podcast. Special thanks again to our guest, Dr. Gregg May. You
Thanks
can
for
find him
inviting me, guys.
at drgreggmay.com. That link will be in our show notes. You can also find that and all related links to our podcast on our website. You can also, we're doing ask questions to our CEO, Weston Lunsford, on our webpage at dentalintel.com. Thank you again to Curtis Marshall for joining me today. And thanks to Tyler Johnson, who is our product specialist and sound engineer. I'm Katie Polson. Keep growing, guys. Have a good one.